Hello everyone, this is Pathak and you're watching my channel. So today I will talk about chapter number 8 of NABH 5th edition, which is Facility Management and Safety. And you can also see the Instagram ID on my slide, which is Healthcare for You Forever. You can follow my account, and also please don't forget to like, share, subscribe my channel. I will be really very grateful. So let's get started with this particular chapter. Okay, so now I'll talk about the intent of the chapter. So SANS guide the provision of a safe and secure environment for patients and their family members, staff and visitors. The organization attends to the facility, equipment and internal physical environment for improving patient safety and quality of services by consistently addressing issues that may arise out of the same. The organization does this through proactive risk analysis, safety rounds, training of the staff on the enhancement of safety and management of disasters. To ensure this, the organization conducts regular facility inspection rounds and takes the appropriate action to ensure safety. So this was the one intent of the chapter. So the rest of the intent of the chapter is given on the next slide. So let's move on to the next slide for the same. So here's the second part of the intent of the chapter. So the first point here on the slide is the organization provides for a safe water, electricity, medical gases and vacuum system. The organization has a program for medical and utility equipment management. The organization plans for fire and non-fire emergencies within the facilities. The organization is a no-smoking area. The organization safely manages hazardous materials. The organization works towards measures on being energy efficient. So this was all about the intent of the chapter. So let's move on to the next slide, which will talk about the standards. Okay, so the first standard here on the slide is the organization has a system in place to provide safe and secure environment. This basically means the organization has facilities for differently able. Differently able people means that people who are visually impaired and mentally impaired. So a special toilet for differently abled and wheelchair accessible entrance is there, okay, so that there is a safe and secure environment for these people as well. Then different kind of devices are installed like grab bars, bed rails, call bells, fire safety devices to ensure that there is a safe and secure environment in the organization. So now let's move on to the second standard, which is the organization's environment and facilities operate in planned manner and promotes environment friendly measures. So this basically means that facilities and space provisions are appropriate to the scope of services. There are internal and external sign postings in the organization in a manner understood by the patients, families and community. Potable water and electricity are available round the clock. Okay, so this is all involved in the second standard. So the third standard is the organization's environment and facilities operate to ensure the safety of the patients, their families, staff and visitors. This basically means the organization tests the functioning of these alternative sources at predefined frequency. Then the organization takes initiative towards energy efficient and environmental friendly hospital, okay, and the patient safety aspects in terms of structural safety of hospitals, especially of critical areas, are considered while planning, design and construction of new hospitals and replanning, assessment and retrofitting of existing hospitals. Now let's move on to the fourth standard. The fourth standard is the organization has a program for facility engineering, support services and utility systems. The organization plans for utility and engineering equipment in accordance with services and strategic plan. The equipment is inventoried and proper logs are maintained as required. The documented operation and maintenance plan is implemented. So this is all included in the fourth standard. Now let's move on to the next slide, which will talk about the rest of the standards of this particular chapter. Now I'll talk about the fifth standard of this particular chapter. The organization has a program for medical equipment management. The organization plans for medical equipment in accordance with its services and strategic plan. Medical equipment is inventoried and proper logs are maintained as required. Then medical equipment is periodically inspected and calibrated for their proper functioning. Qualified and trained personnel operate and maintain medical equipment. Written guidance supports medical equipment replacement and disposal. So all this is covered under the 5th standard. Now 6th standard is the organization has program for medical gases, vacuum and compressed air. Written guidance governs the implementation of procurement, handling, storage, distribution, usage and replenishment of medical gases. Medical gases are handled, stored, distributed and used in a safe manner. The procedure for medical gases addresses the safety issues at all levels. The organization regularly tests the functioning of these alternate sources. Alternate sources for medical resource gases, vacuum and compressed air are provided in case of failure. There is an operational inspection, testing and maintenance plan for piped medical gases, compressed air and vacuum installation. Now the 7th standard here on the slide is the organization has plans for fire and non-fire emergencies within the facilities. The organization has plans and provisions for early detection, abatement and containment of the fire and non-fire emergencies. Mock drills are held at least twice a year. The organization has documented and displayed exit plan in case of fire and non-fire emergencies. So exit plan and the mock drills are really very important. Mock drills are conducted so that the staff is trained how to handle these fire and non-fire emergencies. And there's a maintenance plan for fire-related equipment and infrastructure. The organization has a service continuity plan in case of fire and non-fire emergencies. So this was all about the chapter number 8 of NABH Science 5th edition, which is Facility Management and Safety. I hope you really like this video. Please do not forget to like, share, subscribe. Thank you for watching my video. I hope you really like this video. Please do not forget to like, share, subscribe my channel. I will meet you in the next video, which will talk about chapter 9 of NABH Science 5th edition. Till then, stay tuned and stay safe and healthy. Bye bye.